Hi, I'm Dr. Rick Pumill from Cross County Cardiology, and welcome to Whiteboard Wednesdays. Today I thought we'd talk a little bit about heart murmurs and what they mean. So a heart murmur is a sound that we would hear through our stethoscope when we're listening to your heart. Many things can cause a heart murmur, but most often it's a valvular abnormality. So we have four valves in the heart. We have the aortic valve, the mitral valve, the tricuspid valve, and the pulmonic valve. Most heart valve abnormalities occur in either the aortic valve or the mitral valve. Mitral valve prolapse causes a murmur, mitral regurgitation causes a murmur. With aortic valves, it's typically stenotic or leaky. As we get older, aortic stenosis would be the most common valvular abnormality causing a murmur, and that's restriction of the valve. So let's say the normal valve looks like a peace sign when it's closed, and when it's open, it should look like this, so blood can travel through it. As we get older, calcium deposits start to develop, and it restricts the opening of the valve, and now you have aortic stenosis. Mitral murmurs, most often talked about as mitral valve prolapse. So when you think about the mitral valve, upper chamber of the heart, lower chamber of the heart, blood comes through. This is the mitral valve. Normally, the mitral valve should close on this side. Mitral valve prolapse means it's prolapsing backwards, and that can cause a murmur and some leak. This is the most common murmur that people talk about when they talk about young people having heart murmurs or mitral valve prolapse. Most times no treatment is necessary for that unless it's moderate to severe, and the same thing is the case here. We would just follow it periodically, make sure heart function doesn't change. So in summary, two of the more common valves that we see abnormalities with or murmurs from are from the mitral valve or the aortic valve. They could either be leaky or blocked, so-called stenotic, and both have easy treatments nowadays, often done with medication, occasionally done with open heart surgery, but now there's new procedures as well where valves can be fixed through the groin rather than cracking open the chest. So thank you for listening to a short synopsis on Whiteboard Wednesdays from Cross County Cardiology regarding valvular heart disease.